Hi everyone! Today I want to talk to you about the effects of missing a tooth. I know a lot of people out there say, what's the big deal? I can eat perfectly fine without my molar back there, right? You probably don't miss it anymore, and that's fine. I know that our treatments of choice are always do nothing. But it's also important to inform you on what are the effects of doing nothing. Before I explain to you, I have this little one today here. Here's Miss Peony. Say hi. Fun fact is that she's missing several teeth, and I feel bad because her bite is just completely off. I don't know if she's gonna let me show you here. No, you don't want to? Okay. But there's nothing we can do on dogs, right? But good news is that we can always do something on patients. So first thing is that your bone is gonna start to reabsorb. The bone is just gonna start to shrink in size. This is because we don't have those biting forces anymore that are stimulating bone production. So that bone will just shrink and shrink in size. As time goes by, it's just gonna get worse and worse to a point that you might not be able to restore that missing tooth anymore, because that gap is gonna close, and then there might not be enough room for a crown or enough bone for an implant. So you would need other treatments in order to restore that. So something to consider. It's just like when you exercise, right? You exercise, you do weights, your muscles are nice, they start to increase in size, they're nice in tone. You stop working out and they just shrink. So same concept with bone. You don't use it, it starts to decrease in size. The other thing is that your teeth will move. What do I mean by this? Teeth will misalign, they will shift. Let's imagine that you were missing this tooth right here. These two teeth are gonna move like that, and they're gonna try to close that gap, and the one on top is gonna over-erupt. It's gonna start going like that until it touches something. Sometimes they go all the way to the gums. So this is gonna cause a problem with your bite. Of course, it's just gonna shift everything. There's gonna be teeth that are gonna be touching more than others. This can cause a tooth fracture. It can cause tooth sensitivity or pain. On the long term, you can also have TMJ problems, right? That clicking, popping on your jaw. So that's the second problem there. The third one is gums. You can experience some problems in your gums. Why? Well, same thing. Your teeth are not positioned properly anymore. You can get a little pockets in your gums. When you don't do anything about it, there's also like bone loss in those areas. Bad breath, bleeding on brushing, flossing, etc. Another thing that I often see patients are not aware of is that your facial features can change. Let's imagine that you get that canine pulled out, right? Well, that canine serves as a support for your muscles. If you pull that tooth out, you're gonna have a little dent in there. Yes, it's not gonna happen overnight, but it will eventually show. But I always recommend my patients, if you get a tooth extraction, we always want to do bone graft right away. That way that bone heals, and then eventually we can place an implant if you're a candidate for that. So let me know if you have any questions. I know that it might be something you're not interested in because you already got used to not having a tooth there, but know that there's always treatment options for you. Thank you.